very interesting and key findings in patients who are experiencing signs of dementia and Alzheimer's disease in terms of their MRI imaging. You can see here, for example, that the area called the hippocampus, which is a deep structure in the brain, is showing a significant amount of atrophy in this patient who clearly has severe signs of dementia. And you can see that here, where there is significant shrinkage of the area called the hippocampus. Now, contrast that to another patient who has some mild cognitive impairment, but not nearly the same level of memory loss and cognitive dysfunction. You can see the difference between these two here. Campus is a lot more full and far less atrophy than in the other image that was shown here, where you can see significant amount of atrophy. The other patient that we had here, this is again an elderly patient above the age of 80 who has some signs of memory loss, perhaps with naming, but not nearly as severe as this case where there's significant dysfunction. So again, if we look at slices of the brain from a sagittal perspective, i.e. from side to side, you can see that there's atrophy here in the frontal regions of the brain. Same age person with significant dysfunction, you can see that there's a lot more atrophy or shrinkage of key brain structures in the prefrontal cortex. For example, here you can see the what's called the cingulate sulcus, which is the space between the cortical gyri here, is far wider in this case than it is in the same area for the other patient who doesn't have nearly as much dysfunction. If we go to that image now, you can see those differences. So the picture on the right shows a huge amount of widening of the cortical sulcus. You see all the space here in between the cortical gyri, whereas the person on the left, who is actually slightly older than this person on the right, has not nearly the same level of spacing between the gyri here, which is very interesting. And here you can see the close similarity between the image on the right and the image on the left, whereas the image on the right is of a patient who has severe dementia, whereas on the left, the patient has very mild difficulty with naming. So there are other factors, and imaging is not the only modality that can be helpful, but there are some subtle abnormalities here. For example, look at all the spacing between the gyri here. There is slightly less spacing in between the gyri in this case. MRI is not the only tool used to detect dementia, but you do see differences between someone with severe cognitive impairment on the right and someone with much milder cognitive impairment on the left. Hi guys, so that was an example of two actual patients, one who had severe dementia and another who had relatively mild cognitive impairment and some name forgetting. And you can see the differences between those two MRIs. One had a lot more atrophy, specifically significant shrinkage of the hippocampi. The other did have atrophy, but not nearly as significant. While MRI is a tool that can be used to differentiate between Alzheimer's and mild cognitive impairment, it is not always reliable. And there are other tools now, including blood biomarkers that can be used, along with, of course, the gold standard of a good comprehensive face-to-face examination, standardized bedside exams, and other tools. But I thought that was interesting, MRI differences. I hope we enjoyed this. There will be more to come. We have now a platform where you can actually ask me questions directly. There has been a significant amount of interest in answering questions relevant to all the technology that we're discussing, MRI imaging, and many others. So now you can go on BuyMeCoffee platform and, in fact, become a member and ask specific questions from me, along with other exclusive content that you can have access to. Hope to see you there, and I'll talk to you later.